checking. Means you have good patience. Okay. So disc is full name is, what is full name of disc? Intervertebral disc. Inter means the inside vertebral. Disc is always between two vertebral column. Intervertebral disc. Okay. How many vertebrae we have on the cervical? 7. And how many vertebrae on the thoracic region? 12. And on dorsal?
12 on dorsal, 5 in dorsal.
Thoracic and dorsal are same name in different language. Okay. In some MRI,
So I can say
in the cervical we have how many vertebrae in the cervical? 7. Okay. And in thoracic we have 12. So in some MRI they mention dorsal vertebral D8, D9. Okay. Dorsal and thoracic they both are the same. Okay. Latin and Greek different language they are using. Okay. And in a lumbar 5. And sacral
5 and
Fuse.
it's 5 now. After that it's become like all joints. Okay. And there is space between the coccyx and sacral region. Okay. There is only one space between the coccyx and the sacral region. Can you see the tailbone? Going to animal, right? You have a long tail. So this tailbone, there is many patients are coming for tailbone issues, no? Okay, we discussed it. Tailbone is very important. This tailbone is controlling your all alignment of your spine. Okay. Tailbone is very important.
So pregnant women have a lot of issues with tailbone. There is a recently pregnant lady talking. No, that is a recent.
Yeah, we can just analyze. They have practical experience.
Yeah, that's what I'm saying.
Yeah. Okay, so this. Okay. So this is the lateral view, okay, and this is on the top of the view. Alright. On this vertebral body, where is the disc? On the vertebral body. So
Yeah.
this is the called vertebral body.
Yeah, on top of this.
Okay.
Circle.
Yeah. Vertebral body, and this one is called transverse process. So anything which is coming out little bit like this extra bone growth, like this one, they are called process. Transverse process, and this one is Spanish process, and here. Okay. On the vertebral body, so this is the solid bone. This is the solid bone. It's flat bone like this. Okay. This is the two side bone, and this is the two long and like back side bone. So on the vertebral body, here is the disc. Yes. This is the disc. Okay. Our disc anatomy. Yeah, circulatory. Our disc is designed and anatomically it's like separated with two parts. Okay, the blue color is called annulus fibrosis. Okay, then inside the annulus fibrosis there is one more disc. This is called nucleus pulposus, like this something. Annulus fibrosus and nucleus pulposus, something. Annulus fibrosis. Okay, and nucleus pulposus. You can check the spelling mistake in Google. That will be good for you. Okay, so what we have, blue color, that is a strong disc, strong filament, and the green marker, that is a jelly. Okay, both are discs is designed by same material only. Collagen second and fourth, both are designed by same material, but on the side the filament, they are the solid filament. Okay, because they are holding your jelly. Okay, and inside the filament they are very soft filament. Inside the green color, that are the soft, very soft jelly. Okay, so around this jelly, annulus fibrosis, this is our like circulatory filament. Okay, one filament like 1/3. This second third, fourth third, fifth third. Like this, there are many circulatory threads, circulatory filaments. So it's count like from the 18 to 52 threads in one area.
Okay.
18 to, for example, in this part, the filament is not that much many filaments because need more this one rotation. So if there is more filament, then you are not able to rotate properly. So if you check here on the toward of the spine, there are the 52 filaments. If you check here, around the 40 filaments on the anterior part. Okay, because if the disc bulges from the here, then they will block your all the lower spinal cord. Then you will be paralyzed. Understand? For example, on the lateral side, the filament is very less. So they give you rotations movement. Okay? But on the back side and on the anterior side, they are the 52 filaments. They are very thicker filaments. So by chance, if the disc is come out from the posterior side, I am talking about the hair. Okay? Can you see this wire inside the spine?
Yeah.
The wire is your spinal cord. Okay? So if your disc bulges on the posterior side toward of that wire, then the patient will be paralyzed. There is no circulation in the leg. Now gets blocked. Maybe that strong stimulation will go to your brain too. Maybe will die. Okay, so that's why to protect that spine, the God give us like lots of the filament in that area.
Thick.
Okay. Now each and every, for example, this is our disc here. This is lateral view. Okay. Lateral view. Lateral view किसको बोलते हैं?
Elevation.
From side.
On side.
ये side view. जो मैंने draw किया है, वो ये side view है sir. Okay. So this is the lateral view. For example, this is my spine and I am standing like this. Okay. If you see here, can you see this one? This is the nerve. This is the your spinal cord. This is the spinal cord like this. The spinal cord is the back side the disc. This is the disc. Okay. And here, can you see the gap? That is a spine cord. All nerve is traveling from here and they are coming out from the here. Inside the your transverse portion, they are coming out like this.
Yeah.
Okay, they are coming out from the here like this, from inside the transverse process. Okay, that's why when we are inserting needle from the here, so the needle is very thin. If you are coming from the here, this bone is blocking. Understand?
Yeah, that's called transverse prosthetic.
Yeah. Okay. Now, this is the one vertebral column. This is second vertebra. So vertebra is bone, right? And this is also vertebra bone. So who is holding one vertebra to another vertebra? Who is the hold bone to bone?
This vertical.
Oh, the
Bone to bone.
ligament, right?
Ligament. Who is hold bone to bone? Ligament. So this is the one bone, and this is the another bone. So our whole spine is holded by ligaments. Okay, and movement is comes from muscles. Okay, so our whole alignment is holded by ligament, not the muscles. Understand? The muscle is create the movement.
Yeah.
Understand? So all the ligaments are here. This ligament is holding from one vertebra to another vertebra like this. The ligament is holding like this, and your muscle is giving you mild movement. Got it? It was very simple. Wow.
Not this, the other.
Which one? This one? अंदर के साइड में जेली होता है, बाहर के साइड में हार्ड डिस्क होती है. समझ में आया? उसमें हम आएंगे.
तो अभी आप बताया ना कि ना वो अगर नीचे वाला पैरालाइज हो जाता है, अगर वो डिस्क कहाँ से निकलता है तो पैरालाइज?
डिस्क बैक साइड में यहाँ से नहीं निकलना चाहिए, इसलिए यहाँ पे बहुत ज़्यादा
बैक
थिक
साइड कैसे होगा? मुझे तो वही नहीं समझ आ रहा कौन सा
वायर दिख रहा है. इस साइड में डिस्क निकल गया तो आदमी पैरालाइज होता है.
पीछे की
क्योंकि वायर कट से जाएगी या कट जाएगी.
और अगर साइड से निकला
तो कोई
तो वो
प्रॉब्लम
डिस्क
नहीं, तो वो लेग में मसल में प्रॉब्लम करता है. Okay, so from the all side, from the four side, each and every ligament is holding the vertebral column. Each and every ligament is holding the vertebral column. So the first on the anterior side, which is the here, on the front side, okay, like this. This is the front side. This is the one ligament. Okay. Want to know the name? The position is anterior.
Interior ligament.
Anterior.
Interior.
Longitudinal. Long ligament. Longitudinal ligament. Short name is ALL. All. Okay. Anterior longitudinal ligament, which is start from your coccyx region. Okay, from the inside coccyx region and going like this till here. The whole interior spine is holded by this ligament. Okay, towards the organ. Here we have the organ. This all are organ. Inside this spine is pure held by this ligament from the coccyx to till the head. Okay. Then again, just exactly backside the spine, backside the vertebral column here. Okay, exactly backside the disc. This is the opposite. This is the interior part of the disc, and this is the just posterior part of the disc. The same ligament, but the name will change. What name will change? This is the anterior. That will come posterior. Okay. Anterior means the inside longitudinal ligament. Why is longitudinal? Because that's long ligament. Going with the whole spine, only one ligament. Understand? And the same ligament on the posterior side. So that's why called the one posterior longitudinal ligament, which is same going from the back side disc. Okay? Can you see that wire? Inside the wire, holding from the here and from the here going till the end. Okay. So one ligament.
Start from the coccyx or will start from up?
No, it will start from the sacral region mostly because sacral there is no gap to go. So one ligament is here. Okay, and second ligament is here like this. Okay. Now these two ligament is holding your disc also. One ligament is inside, one ligament is back side. So anterior side, posterior side. So there is very rare case where you will find mild disc bulge on the anterior part or the posterior part. Because two reasons. One is aneurysm fibrous is very strong on the anterior part and posterior part. The second, there is two big ligaments, which is the longitudinal anterior ligament and longitudinal posterior ligament. So there is no chance to have like disc bulge in the posterior side or anterior side. Only in one condition it's happened with accident. Okay. If you having any like alignment, muscle tight, that tight, but the ligament and the aneurysm fiber will not tear on the posterior side, on the anterior side. Some accident happen in your whole spine like that. Only in that conditions maybe it will happen. Okay. So maximum disc bulge happen on to lateral side.
Yes.
Okay, especially on the lateral posterior side, because this anterior longitudinal ligament comes on the side of the half of your side spine. For example, from here, it starts from the here. Anterior longitudinal ligament
Portion of the side.
yeah, it starts from the here and it will go till here, right on the side of the spine till here. So this is holding your all anterior and third half of your lateral side of your spine.
So back lateral disc.
Okay? Yeah, and posterior longitudinal ligament comes only till here.
So small thing.
So that's small.
Okay? So this is the gap. Can you see this gap?
Yeah.
This is the gap. There is just mild filament. There is not a strong ligament. Okay? And this position is called lateral posterior side. Lateral on the spine, on the MRI, where you will check the MRI between the L4, L5. Okay? Left side, lateral posterior side, first stage disc bulge. Disc herniated, disc bulge, there are different names. So just understand the lateral posterior side between here. Got it?
Yes.
Now there are three ligaments which are holding your spine position. Okay? One here between the two transverse process. From the here to here. From the here to here. It's called intertransverse ligament. Because inside the transverse,
Yeah.
so inter. And connected with transverse process, so ligament name only transverse.
So the small ligament.
Yeah, intertransverse ligament. Here it's connected like this, my okay? It's connected like this. Intertransverse ligament.
What's the last part that you told that intertrans?
Intertransverse ligament. Intertransverse ligament. Transverse. The same. So we wrote here. Transverse process. This transverse process. So same. Inter means the inside transverse ligament. Intertransverse ligament, which is holding from the side.
These are transverse. Yeah.
Okay. So he will not find any case. In that case, the ligament become the tear. Spine ligament are very strong ligament.
Ah, okay.
Okay, there is no tear. Just to remember this for you, Otherwise, no humerus. Humerus is only one ligament. That is the that is the here. This is your spinal cord. Just backside your spinal cord. Here is one ligament. This one. Okay. Now see, two ligaments on the anterior part of your spinal cord, and there are the two ligaments here. This is the posterior part, and one ligament for the transverse process. This is called the central ligament, because two ligament posterior, two ligament interior, and this is the central ligament. So the name of the central ligament is ligament flavum. Ligamentum flavum. On the MRI you see ligamentum flavum.
That's on the interior.
In many MRI, you will see this ligament flavum strengthening.
It's what?
Is what?
Yellow ligament.
Ligament flavum strengthening means
Oh, it's
become straight.
straightening.
Strengthening. Okay. This ligament when become a little dry, this will change your curve. Mostly as set spine, Yeah. If this ligament becomes tight, your spine becomes straight like this.
Oh.
Okay. When your spine becomes straight, okay, your body is not able to divide the weight. S shape what is doing? S shape is dividing weight in different parts. For example, now if your head is more back side, then more pressure is coming this side. Cervical more inside, then weight is dividing this side. Thoracic is little bit on the posterior side, weight is going more gravity side this side. Lumbar is more this side, and weight is going more on this side. So the weight will not come on the specific one point. Weight will be
Yes.
divide. But when your spine becomes straight, okay, if you do any activity, then maximum pressure is going on your disc, going on your spine.
So this will get done here.
Yeah. Then in these conditions, there are multiple discs herniated. The patient will, the doctor will mention L4, L5, L3, L2, L1, T2, like this multiple discs. Okay, the people's spine becomes straight, and there is lots of the pain in the leg and the spine and everywhere. They are not able to do proper flexible. They are not able to do like this because the spine is not bending. Alright? Due to these ligaments, when we slowly become older, this ligament is slowly contracting, and our height is reduced in after
40,
after 40
50
years. And 60, our height is reduced because slowly this ligament is contracting and creating the pressure on the disc, and this doctor used to say in after age of the 50-60 normal disc degeneration is normal.
Yes.
Because of only this ligament. If you are giving the proper flexibility spine, then you will not suffer with that problems.
So the solution is twisting flexibility.
Twisting, do proper flexion, extension, this will help. And this ligament, each and every ligament is holding one position. Okay. For example, the anterior ligament, this ligament, anterior ligament,
Yes.
the function of this ligament, when you are doing the forward bending like the back bending like this, okay, this ligament is holding your limit.
Yes.
Okay, always remember the muscle and ligament, they both are function opposite. Muscle and ligament, for example, if I am doing like this, which muscle are contracting? The back muscle are contracting. But who is holding my limit?
The front.
The front ligament, not the muscle. If there is no ligament, you can stretch muscle like this. Okay? My muscle are not holding my capacity, my bending capacity. My ligament is holding my bending capacity. Because when I'm doing like this, okay, so this is what is happening,
Yes.
expanding like this.
Yes.
And after one of the stretch, the ligament hold, okay, ball don't go more than this. Otherwise you will be in danger zone. Understand? So when I go like back bending like this muscle are contracting. But this muscle are stretching, this ligament is stretching and holding my one limit. When I am using my this muscle to forward bending like this, okay, then back side of the spine, on the spine, there are this ligament, okay, inter and supra spinous ligament. These ligament are holding my forward bending limit. Understand? When I am going on the lateral side, so intertransverse ligament, this ligament is holding my limit. Understand? That's why I used to say, if you are not that much flexible, please do not give the more pressure immediately to flex your body within 5 days. Because if you are not enough flexible, if you are giving the more pressure from the back side, then pressure is not going on the muscles. That pressure is going on the ligament. That pressure is going on the I am trying to flex, my body is not that much flexible. Okay? Because my back ligament are very stiff. If you give the more pressure, then I am trying to stretch ligament. But ligament will not stretch that fast. Ligament having the very less amount of the fluid. Ligament are dry. It takes time and proper exercise to release slowly. Okay, ligament are very strong. That's why some condition they are giving lots of pressure, nothing happened. So they get more confidence. Oh, nothing happened. I stand on this person like full my body weight. His ligament is nothing. But someone's ligament are very stiff. You will do the curl. Okay. So and this ligament, what we are talking about ligament flavum, the function of the ligament flavum is holding your spine to not stretch too much. When you are doing stretching like this, no? That is your ligament flavum.
So I can understand, where is the ligament flavum? Positioning, where is it?
Yes, just exactly back side of the spinal cord.
Behind the...
Exactly in the center. See, this is the spinal cord. Just exactly back side of the spinal cord, in center of the spine. If you count this volume, no? If you count from the last spinous process to interior vertebral body volume, ligament flavum is exactly in the center.
Then where is posterior then? I thought anterior was posterior.
Posterior longitudinal ligament, right?
Yeah.
This is just backside the spinal vertebral body.
Oh, so there are two. There is one behind that.
So between these two, between ligament flavum and posterior longitudinal ligament is the spinal cord.
Okay. So both sides there is it's really protected. Yeah.
Okay, so when you are lying down and I am stretching your leg, pulling your leg, I am pulling your neck, that is I am activating your ligament flavum. Understand? Ligament flavum is holding your stretching, the vertebral contraction and expanding capacity.
That's why you are not taller, otherwise you will be taller with stretching.
Yeah. If you do the proper stretching ligament flavums, maybe you will be good.
If there is ligament tear,
Which ligament tear?
any there.
In the spine, you will not find any ligament tear. If you find, then you can suggest to orthopedic surgeon.
There is no other group.
You have to be stationary for a long time for the ligament to heal, right? Ligament doesn't heal quickly.
To heal the ligament,
It takes months.
you have to stop the movement.
Yes, like a
Okay,
bone.
completely stop the movement. If they purely tear, then don't take risk that, because if they tear, then of course you have to go for operation and fix that first.
Yeah.
Okay, if there's like 70%, 80% tear, but still 20% thread are connected, that will you can heal, but for that, just stop the movement. Okay, I'm just holding my leg this and you are doing a treatment, then it will heal fast. Okay?
That's why athletes, when they have ligament tears, they are advised as or a surgery. There is no other option.
After a surgery, then
Yeah, because then the ligament is being connected back there.